Thank you for joining us for today's NILE webinar. This is Breanne Van Dyne, the Education Manager for Immunize Nevada, and I will be today's moderator. Before we get started, I'd like to review a couple of housekeeping items. First, if we should become disconnected for any reason, please call right back and we will continue where we left off. Second, please locate the chat box in the bottom left corner of your screen. If you have any questions, type them in the audience chat box and we will address those questions at the end of the presentation. Lastly, if you have requested nursing, pharmacy, or physician continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar is ended, or all CEUs will be emailed out within the next week. Before we begin, I'd like to provide a little disclaimer. Immunize Nevada NILE webinars are made possible by the generosity of speakers who donate their time and expertise to benefit the coalition. The expectation and goal is for community partners to gain knowledge on immunization-related topics through a non-branded, unbiased presentation. I would like to now turn it over to our speaker, Dr. Catherine McCarthy. Dr. McCarthy is a professor in the Department of Family and Community Medicine at the University of Nevada, Reno School of Medicine, where she completed her residency in 2003. Dr. McCarthy has been active in the Nevada chapter of the AAFP, on the board of directors, as past president, AAFP delegate, CME chair, and as a foundation trustee. She has also served the AAFP on the Commission of Health of the Public and Science, and as a liaison to the American College of Obstetrics and Gynecology. She has served on the AAFP committees and working groups of public health issues, primary care, and public health integration and clinical practice guidelines. Welcome, Dr. McCarthy.
Hi, everyone. I'm glad to be here and very excited to talk to you about something that I'm quite passionate about, which is the HPV vaccination. I will facilitate today's training about making effective HPV vaccine recommendations and addressing parents' questions and concerns. This training is different from others because it has been rigorously evaluated in a randomized controlled trial. It's endorsed by the National Cancer Institute and uses techniques recommended by the American Academy of Pediatrics. To ensure fidelity to the approach that these organizations recommend, I'll be using a standardized script for much of this training. Your role in HPV vaccinations. We're going to start with some introductions. I think Breanne is going to handle this.
I am. So let me go ahead and push out the survey real fast for you guys. So in your medical setting, please select all the roles that you are responsible for. So this would include any role that you see on the screen that would meet the description of what you do in your particular medical setting. We'll give everyone a few more seconds to respond. So far, we have several people on the call who are either public health or healthcare professionals and don't work in the medical setting. There are a few of you who are actually administering the shot. It looks like 4 so far. And then there are others who are charged with recommending the HPV vaccine to adolescents and their families, which is, of course, I'm sure why you're on today's webinar. And then there's a few of you who are charged with greeting parents and scheduling appointments. So I'll go ahead and send those results to you guys. And if at any time you do not wish to see those results anymore, just go ahead and click the X in the upper right-hand corner. And you can go ahead and continue. Oh, and I'm sorry, we have a little bit more to say about that. We hope today's training will give you the opportunity to hear how your colleagues communicate about HPV vaccine and to align your messages across your clinic in a powerful way. Many of you recommend HPV vaccine for 11 and 12-year-old patients can one of you share, or a few of you share in the audience chat box, what it is that you usually say when you're recommending the HPV vaccine? So this will take just a few seconds. So this is a way for you guys to get involved and have us kind of take a look, or have Dr. McCarthy take a look at what it is that you normally say when you are recommending the HPV vaccine to the patients that you work with. We'll give you a few seconds to do that. While we're waiting for those to come in, just a note that there's no right or wrong answer when it comes to how you're making the HPV vaccine recommendation. That's why we're all here today, is to learn a little bit more about how we can refine that approach. We did get a response in. The response from Christine says, I see that you're here for your child's flu shot. Would you also be interested in getting them vaccinated against HPV today as well? So I think that's a great recommendation. What do you think, Dr. McCarthy?
Absolutely. I think that's a great way to phrase it. We're going to talk a little bit about how we bundle the vaccinations together, and we're going to talk some about a presumptive approach. Does anyone else want to enter any suggested script that they use?
We did get another suggestion in, or just approach that another viewer uses, and she says that when she is asked about HPV, she discusses stats about HPV prevalence and cervical cancer risk.
Okay, that's great, and we're going to talk a little bit more about that. Well, let's continue. It's probably not surprising to you that your advice as healthcare professionals is trusted and can have a big impact on vaccination decisions. We as providers are uniquely influential. Our goal is to help you optimize your communication so that you make effective HPV vaccine recommendations and efficiently address questions and concerns. Our approach is designed to meet the needs of the parents we see most often, parents who already want to vaccinate or may decide to vaccinate with the right information and support. Like other vaccine promotion efforts, our approach may be less effective with the small minority of patients who strongly oppose vaccination. However, we'll talk about how to manage those difficult discussions in a way that saves time and builds trust. Today's activities will start with a brief review of the latest research on HPV vaccination practices. We'll then move into building your skills in effective communication. And then we'll practice the communication approach. This is a great opportunity to receive CME credit, and at the end of the presentation today, please complete the post-training survey in order to receive your CME certificate. Now, let's review the evidence. I love this slide. We know that HPV is common. In fact, almost 80 million Americans are currently infected with at least one strain of the virus. Almost all of us will get the virus at some point in our lives. This pyramid shows the number of cancers attributed to persistent HPV infections in the U.S. each year. HPV causes 6 cancers, and this translates to almost 34,000 new cases of HPV-related cancer in the United States each year. Notice the purple regions that show, for example, vaginal cancer, vulvar cancer, anal cancer, and cervical cancer in women. But also notice the blue regions that show penile cancer, anal cancer, and oropharyngeal cancer in men. The incidence of oropharyngeal cancer has tripled in recent years. New cases of this cancer are now more common than cervical cancer. Of course, HPV also causes thousands of cases of genital warts. HPV cancers have very real consequences, as we will see in this short video about cervical cancer.
And I'm going to go ahead and launch that video now.
My name is Lisa Moore. I'm 30 years old and I live in South Bend, Indiana, and I was diagnosed with stage 1B1 adenocarcinoma of the cervix at 26. No one deserves this. Bowel obstructions are not fun. Neph tubes are not fun. Tubes in your stomach aren't fun. The side effects of the treatment are not fun. If something like this is preventable, I don't understand why people don't want to prevent it. If it was a leukemia vaccine or breast cancer or prostate cancer or anything not related to sex, there'd be no question. Cancer sucks. It takes and takes and takes. And majority of the time, it takes everything and kills you. If I can help somebody else not go through this, that's probably the best thing I have to offer at this point.
Okay, Lisa asked that her story be shared, and she offers us a powerful reminder that HPV vaccination can prevent suffering and save lives. I found that video to be very moving. So now let's go on to talk about some HPV vaccination recommendations. The CDC recommends routinely giving all children ages 11 or 12 2 doses of HPV vaccine. The vaccine is especially effective in younger adolescents. Giving HPV vaccine at a younger age is twice as effective at protecting against cervical precancers. There's more immunogenicity in the younger adolescents, so they have a better immune response to the vaccine, and they are less likely to have been exposed to HPV already. All adolescents should get the HPV vaccine, not only those at high risk. And this is because vaccination based on risk just doesn't work. Kids are late if they have not gotten the vaccine by age 16. The CDC recommends giving 3 doses instead of 2 doses if children haven't started the series yet by age 15. I really like this slide also. I think we should have bumper stickers here. The key thing is HPV vaccine is cancer prevention. Many people think of HPV as an STI or sexually transmitted infection, but what really matters is that it's common, and many types of HPV are carcinogenic. The HPV vaccine can protect against cervical cancer and can also protect against vulvar, vaginal, and anal cancers, and probably also oropharyngeal and penile cancers too. So in summary, it's a vaccine against cancer. What's amazing is how effective this vaccine is. The impact of HPV vaccine has been a sharp decline in cervical precancers. On the bottom of the line, you can see the years, and on the left-hand side, you have the number of cases of CIN2. This includes cervical intraepithelial neoplasia, grade 2 or more severe, and adenocarcinoma in situ. The solid line shows young women ages 18 to 20 who were screened in any of these years listed below. You can see a large decline in precancers. The second dotted line shows women screened ages 21 to 24. Together, these lines show a 62% decline in cervical precancers attributable to the increase in HPV vaccination coverage. This graph doesn't include older women ages 25 to 39 because these women did not have access to the vaccine when they were younger. They actually had a 40% increase in cervical precancers over the same time period. The increase for older women makes the sharp decline that we see here for the younger women all the more impressive. Since 2006, healthcare providers have given over 270 million doses of HPV vaccine without any serious adverse events attributable to the vaccine other than fainting, which we know is common in this age group. In 2017, scientists reviewed all available data on HPV vaccine safety. They found 109 studies of 2.5 million people from 6 different countries. There was no unusual pattern or clustering of serious adverse events after HPV vaccine was administered. The studies found no evidence for autoimmune, neurological, venous thromboembolic, or any other unexpected health problems due to the HPV vaccination. Even though HPV vaccine is effective and safe, many adolescents in Nevada are not receiving all recommended doses. I know that some of you here today are not from Nevada, but I think that this translates across the country as well. Notice here the blue bars show the coverage for Tdap and for meningitis vaccines. They have met or are close to meeting the Healthy People 2020 target of 80% coverage, which is represented by the dashed line. As the red bar shows, only 49% of 13 to 17-year-olds had received the recommended number of HPV vaccine doses. But together, we can change this. As providers, we tend to think parents don't find the HPV vaccine important, but we might have the wrong impression. The coverage for this vaccine is low for many reasons, but a leading cause is missed opportunities for vaccination when other vaccines are given. A recent study asked providers how important they thought the HPV vaccine was to the families that they serve. We providers thought that parents would rate HPV vaccine's importance as pretty low, at a 5 on a scale of 0 to 10. Surprisingly, parents actually rated the importance of the HPV vaccine as very high, at a 9. Even though parents think that the vaccine is important, many are still not getting their child vaccinated. Parents' reasons for not getting the vaccine are varied, with no single top reason. Some reasons include not knowing enough about the vaccine, concerns about safety or side effects of the vaccine, perhaps feeling that it's not necessary, or that they don't receive a recommendation from their provider. Each of these questions or concerns can be addressed by talking with a provider. So, how powerful are our recommendations? Here's an infographic representing 8,700 adolescent girls in a national study. Without a provider's recommendation, only 35% of these adolescent girls will get HPV vaccination. You can see the difference here on this slide with provider recommendations. 65% of these girls will get the vaccine. So here we can see the true strength of our voice as providers when we clearly recommend HPV vaccination. Provider recommendations are just as influential for boys. Research consistently shows that healthcare providers' recommendations are more powerful than parents' vaccination beliefs, ethnicity, or education. The way you and the team that you work with in your settings provide this communication really matters. The first thing that you say about HPV vaccine will have a big impact. The most effective approach is to start by saying the child is due for adolescent vaccines. We call these presumptive announcements, and they work. As you know, this is the same approach that we use for childhood vaccines and other preventive services. A randomized clinical trial evaluated today's announcement approach training in 30 primary care clinics serving 17,000 adolescents ages 11 and 12. The training increased the rates of HPV vaccine initiation among the adolescents by 5% in just 3 months. These findings were published in the journal Pediatrics. Many national organizations now recommend using presumptive announcements to introduce HPV vaccination, including the CDC, the AAP, and the National Cancer Institute. Before we talk about how to use the announcement approach, do any of you have any questions on what we've covered so far?
I went ahead and put a little note in the audience chat for you guys as well. If you wanted to pose a question there, you can, or if you'd prefer that it be seen just by Dr. McCarthy and I, you can pose it in the Ask a Question box above the audience chat as well. And I'm not seeing any questions at this time, Dr. McCarthy.
Okay, let's wait, and you can all feel free to type in any questions as they arise, and we can address those all in a batch at the end. So feel free to enter anything that you might have a question about as it arises. Okay, let's talk about how to use the announcement approach to recommend the HPV vaccine. To use the announcement approach, you first announce that the child is due for 3 vaccines against several diseases and that you'll give the vaccines today. If a parent hesitates with a question or concern, you can connect, clarify, and counsel. As we just learned, using an announcement increases vaccination rates, but it also has a lot of other benefits. It communicates that these vaccines are just like others you've provided. If you instead begin by going into a lot of detail about the HPV vaccine, it will communicate that there's a problem when there isn't one. Also, parents and providers prefer it. In the words of one provider, it's just easier for parents and it's easier for us. And finally, it saves time so that parents who don't have questions can receive care for their children's other important health issues. So, back to the announcement approach. In many cases, a simple announcement is enough to lead to vaccination, and you should be able to then move on with the rest of the visit. So let's talk about each part here individually, beginning with the announce portion. A presumptive announcement includes 3 key elements. First, note the child's age. This cues the parent that what follows is part of routine preventive care. Second, announce that children of this age are due for 3 vaccines that prevent several diseases, placing HPV cancers in the middle of the list. This makes HPV vaccine just like the other vaccines. Third, say that you will vaccinate today. You could say something like, so now that Sophia is 12, she's due for 3 vaccines. Today, she'll get vaccines against meningitis, HPV cancers, and whooping cough. For parents, presenting HPV vaccination as part of routine child care should streamline vaccine conversations and encourage bundling it with other vaccines. At this point, most parents agree to vaccinate, and then you can move on with the visit. If the parent hesitates, then we move on to the next step. Some parents will have questions or concerns. If they hesitate, they're usually not trying to be difficult. They're often just looking for some reassurance. And while some parents have questions about meningitis and Tdap vaccines, many more have questions about the HPV vaccine. So let's walk through the key elements of how to address hesitancy. First, you want to connect with the parent. Ask them for their main concern about HPV vaccine. If they say something vague, ask them to be specific. If they have already said something specific, confirm that that's their main concern. You can set their mind at ease only after you get their biggest worry on the table. Their lesser worries tend to fall away once you address the biggest one. Then, you want to show the parent that you're listening. Brief phrases like, "Oh, I hear you," or "I get it," are a good way to start. You can acknowledge their question or concern by restating it, even if evidence doesn't support what they said. If nothing else seems to fit, you can always say that you both want what's best for the child's health. So, get the main question and show them that you heard them. Second, clarify what we know is true using a research-tested message. Each concern calls for a slightly different approach, so we developed clarification messages that resonate with parents. I'll share the messages with you in a bit. In general, parents find clarifications most helpful when they're objective statements. Research has shown that it's best to stay away from anecdotes about what someone you know did or how often you give the vaccine in your clinic. Finally, counsel them to get the HPV vaccine for their child. Give them a reason to vaccinate. This is the place where parents want to hear your opinion as a healthcare provider. You could say that you believe HPV vaccine is very important for their child, and then clearly recommend giving the HPV vaccine today. The key elements are using the words recommend and today. Research shows that patients are 10 times less likely to get a vaccine when providers mention delaying or do not address timing. Saying today specifically encourages same-day vaccination. Here are the messages for the clarify step. To identify these messages, developers of today's training reviewed all available HPV vaccine educational materials. They searched the published literature and interviewed physicians who are national experts. They found over 225 different messages. Then they asked 1,200 parents from across the nation which clarification messages best addressed each of the 7 most common questions and concerns about the HPV vaccine. Here are the very best messages for effectively responding to parents. When a parent says that their child is too young, you could say, kids respond more strongly to the HPV vaccine when they are younger. This may give better protection against some cancers. When a parent says that their child is not yet sexually active, you could say, this really isn't about sex. The HPV vaccine is about preventing cancer. For safety concerns, you might say this vaccine is one of the most studied medications on the market. The HPV vaccine is safe, just like the other vaccines given at this age. You can see here an announcement approach card. One side shows each step of the announcement approach. We also can see the 7 research-tested messages for the clarify step. In addition to the messages I just went through, it has messages about vaccine effectiveness, guidelines, vaccinating boys, and school requirements. Now that we've gone over the communication approach, here's a brief video demonstrating how it might work with the mother of an 11-year-old boy named Michael. We will use the announcement approach to identify key elements in each step and think about how you might make this language your own.
We'll go ahead and launch that now.
So now that Michael is 11, he is due for several vaccines against meningitis, HPV cancers, and whooping cough. So we'll get those done at the end of the visit today.
I'm okay with meningitis and I'm okay with the vaccine against whooping cough, but I'm not sure about the HPV vaccine.
Okay, well, tell me what your main concern is about HPV vaccine.
I'm not even sure. I heard something somebody said the other day about it just not being safe, and I'm just not ready to give it to him yet.
Okay, I hear you. You're wondering then about the safety of the HPV vaccine and any side effects that there might be. It might help you to know that the vaccine is one of the most studied medications on the market, and the HPV vaccine really is safe, just like other vaccines given at this age.
Oh, I didn't realize that. I guess that's good to know.
So because it's a cancer-preventing vaccine, it's very important that Michael get this, and I'd like for him to go ahead and get it today. What do you think?
Okay, we're ready to go ahead.
Great.
Okay, so of course every conversation won't be this straightforward. So to help you out, we've gathered some tips from your peers. The first tip is to treat HPV vaccine like other vaccines. You can do this by bundling your HPV vaccine recommendation with other vaccines. And you can also redirect discussions about which vaccines are required by saying that all 3 vaccines are equally important. Or you could say, I hear you. You're wondering if the HPV vaccine is necessary because it's not required for school. But school requirements don't always keep up with medical science. The HPV vaccine is an important vaccine that can prevent many cancers. Here's the second tip. Focus on cancer prevention. Discussing sex can be uncomfortable for parents and adolescents, and maybe even for some providers. We recommend that instead of focusing on sex, that you focus on the HPV vaccine preventing 6 cancers. If sex does come up, just redirect the conversation back to cancer prevention. So a parent might say something like, my child doesn't need this vaccine because she's not having sex yet. And you could respond with something along the lines of, I get it, I know your child's not yet sexually active. The thing is, this really isn't about sex. The HPV vaccine is about preventing cancer. The third tip is to follow up with parents who say no. While many parents will say yes to the HPV vaccine when you use the announcement approach, some parents will still hesitate, even if you do your best. But there's some good news. Of families who decline the HPV vaccination, the first time that their providers discuss it, almost half of them will get it at a later visit. And another quarter of those plan to get it but haven't had a chance yet. So even if you don't hear yes at that first visit, know that chances are good that the adolescent will eventually get the HPV vaccine. So what I encourage you to do is to try practicing and using this announcement approach on 5 patients in the next 2 weeks. And talk to your colleagues and talk to the other people who work in your office, whether they be the front office or your medical assistants or nurses, about how they're introducing the HPV vaccine. It's really a team effort, from how we talk about the vaccine at the time of scheduling and all of the systems that you put in place to ensure that all children ages 11 to 12 receive it. You may also want to consider other activities that will complement this communication approach. We recognize that communication is only one part of primary care, and other supportive activities could increase vaccine uptake, such as identifying HPV vaccine-eligible patients before their appointment. So to recap, this communication approach starts with a presumptive announcement. First, announce the child is due for 3 vaccines against several diseases. This usually leads to HPV vaccination. If the parent is hesitant, Connect with the parent to identify their main question or their main concern about the HPV vaccine. Then, clarify with a research-tested message about HPV vaccine. And then, finally, counsel parents to get the HPV vaccine for their child today. Sometimes patients ask us for educational materials. Lots of good resources are available on the CDC or the National HPV Vaccination Roundtable websites. However, the materials are no replacement for your very clear recommendations.
Fantastic. Thank you, Dr. McCarthy. We thought that this would be an appropriate time to overview what it is that Nevada is specifically doing with regard to HPV improvements here in our state. We have continuing ongoing childhood and adolescent IQIP visits. Previously, they were known as AFICs. And then we also had the 2014 through 15 HPV-free NV project and the Teen HPV AFIX project of 2016 through 2018 that helped shape the state's HPV action plan for 2019, which aims to address challenges associated with low HPV immunization rates in Nevada specifically. So Immunize Nevada, in conjunction with the state immunization program and our state's comprehensive cancer control program and the American Cancer Society, along with the support of the Nevada chapter of the American Academy of Pediatrics, leverage the strengths of each of our respective agencies and organizations to increase the uptake of the HPV vaccine among the state's adolescent population in 2019. The reach of the proposed project is extended to the Vaccines for Children, or VFC, providers to ensure that patient populations were representative of low SES and uninsured or underinsured adolescents. And the targeted providers included those housed within integrated delivery systems, FQHCs, tribal health facilities, and standalone private practices. So utilizing our robust data that's housed in our state's immunization information system, also known as WebIZ, Immunize Nevada and the state immunization program generated practice-level immunization coverage rates for the first dose of HPV vaccine and also for HPV vaccine series completion. Our team then used the data to identify two groups. The first group was comprised of practices that were falling short of the Healthy People 2020 80% goal coverage threshold for series initiation, and the second group contained practices with high HPV series initiation rates, but series completion rates that were approaching but weren't quite meeting that Healthy People 80% goal coverage rate for the antigen. So just to report briefly on our project progress to date, this is ongoing through the end of the month, so this is going to be preliminary data. But part of the project was administering tailored correspondence to each of the groups. So reminder, recall, technical assistance, clinician and healthcare support staff, HPV-specific trainings, including this one, and technical assistance provided by the Immunize Nevada team and the Nevada State Immunization Program team with regard to improving data quality within Nevada WebIZ. So this involved inactivating patients that are no longer seen by the practice within the system to ensure that those coverage rates that we were pulling were indicative of what that practice's rates really are. And we've seen some promising growth across the targeted practices. As you can see on the slide, of the 25 practices that we had targeted, 18 of those saw an improvement in series initiation for HPV. So that's 78% of the practices. So that's really encouraging. 2 of those practices dropped out of the VFC program over the course of the project, so we did not count them, obviously. And of those practices, we saw an average increase of 6%. So that's really great as well. It just shows you the impact of data quality and reminder recall. And then of the second group, those really great series initiators, but those who are having a tough time completing the series, we targeted 43 of those practices 24 of them saw an improvement in their up-to-date HPV coverage, so that's a little over half. And then the average increase there was 5%. 5 of those practices remain stagnant. We're hoping that as we pull rates towards the end of the month and wrap up the project, that we'll see that those rates have grown as well. So as a result of our work across the last several years, we've developed and compiled numerous resources to assist practices in improving their HPV coverage. And this is just an example, and I apologize, I'm sure that the print is teeny tiny on your screen, but if you are listening today and you are available or located in Nevada, this is a resource that's available to you. These are our reminder recall postcards. They are HIPAA compliant, so we do have envelopes that you'll be able to use as well to de-identify those from, the mail carrier wouldn't be able to see the patient's personal information. It's available, obviously, in both English and Spanish. I really like this resource that we were able to develop because it was specific to the dose and it was specific to the patient. So we're not just looking at some general reminder. This can include the practice's contact information. So it's less likely, we hope, to be thrown in the trash by the patient. And this would also help you guys in your reminder recall efforts, in that if this was returned back to your practice for whatever reason, you would be able to inactivate that patient within Nevada WebIZ and, further refine your future reminder recall efforts, and also not have to continue to have that patient pollute your rates, being that they're not yours. And then the next resource that we have here is our HPV-free NV provider toolkit. I did provide the link there at the bottom of that graphic. That also can be found by just visiting our website and clicking on the Healthcare Professionals tab. This resource was developed as a result of the 2014-15 HPV-free NV project, and we continue to update it with national and local resources regularly. And what we will do now is, as we're waiting for questions to go through, we'd like to offer just a little more time for that. So please type those questions in the chat box now. And I'd just like to provide a couple of reminders to you too. So if you have requested continuing education credits for today's webinar, please make sure you complete the survey, which will pop up on your screen when the webinar has ended. All CEs will be mailed out within the next week. And then if you'd like to view or share this webinar, the recording will be available on the Immunize Nevada website, along with information for future webinars. Please visit immunizenevada.org/webinars for those details. And we have a question that did come through Dr. McCarthy, and there's a little bit of a delay on our end too, so we'll make sure to address any questions that come up post-webinar to you directly too. But one question was that, have you offered any credit or MOC certification in quality improvement for medical boards in pediatric, family medicine, or internal medicine? This is something that I can answer. Actually, Dr. McCarthy and I were just talking about this before I got on the call. We got on the call today. So this is definitely something that we, as Immunize Nevada, are looking into exploring. We've heard of other states who have had success in offering MOC certification, or maintenance of certification, CEs for activities like this. We understand that it's maybe a bigger draw than CME credit offerings would be, so that's definitely something that we're looking to offer moving forward. Dr. McCarthy, also another question that came through was, what is the most common concern or question that you typically get in your practice relating to the HPV vaccine?
I think most commonly the issue that we touched upon regarding sex and the potential relation to this comes up. And I think that this can be a real stumbling block in the office when we bring sex into the conversation. So if we bring up that HPV is a very common sexually transmitted infection, all of a sudden sex is at the forefront, and we get kind of down that tunnel of, oh my goodness, well, she's not having sex or he's not having sex, and we really try not to open that can of worms, right? So I think probably the statements addressing sex and that people have heard that it's a sexually transmitted virus is one that comes up a lot, and that we don't want to stand in the way of getting the kiddos in our practice who should be vaccinated, hopefully by 11 or 12, to get this vaccine. So, most commonly, I think the quickest and easiest thing that you can do is just turn away from that conversation about sex and bring it back to the fact that this is a vaccine that actually prevents cancer, and that these cancers are common, and that the virus is common.
Yeah, I think that that's a great point. And I think also just reframing the discussion, like you had mentioned, to saying that the vaccine is most effective when administered at that recommended age of 11 and 12, long before the initiation of sexual activity. Sometimes that can be comforting to parents too, that you're not saying that, sexual activity is right around the corner, but that, the efficacy of the vaccine is such that, being administered at 11 and 12 would be optimal. So, no, I think that's a great point. I'm not seeing any other questions that have come through right now. Oh, I'm sorry, I do. Why have oropharyngeal cancer rates tripled? That's the question that had come through.
That's a good question. I think that from the vantage point of this presentation, we're speaking mostly about HPV and oropharyngeal cancers that are associated with HPV, and there are, of course, other causes as well of oropharyngeal cancers that we know of that are common, like smoking, tobacco products, chewing tobacco, etc. So the information that I don't have to help me answer the question is, as far as the increased rates of oropharyngeal cancer, how many of those are directly attributed to HPV? So whether there is more diagnosis or if the prevalence is actually increasing. I could certainly see if I could find out a little bit more about that, and I could post an answer to that question.
Perfect. Yeah, we will we'll follow up on that, and then any questions that anyone perhaps poses in the post survey as well. I'm not seeing anything additional so far as questions go. So we'll go ahead and wrap up today's NILE webinar. Thank you again to Dr. Catherine McCarthy and to those of you who participated. And we hope you learned something today, and have a great day. Thank you so much.